Hi, everyone. This is Lee Clark, Senior Director of Patient Programs with the Aplastic Anemia and MDS International Foundation, and welcome to Podcast for Patients. Thank you so much for joining us. And I'm going to have the pleasure today of speaking with Barry Parnas. But before we get started, I'd like to thank our Diamond Level sponsors, Alexion, Apellis, and Novartis, and the generosity of our patients, families, and caregivers who, without everyone's support, our podcast series would not be possible. Welcome, Barry. It's so great to be able to talk with you today.
Hi, Lee. It's great to be here, and thank you so much. And I've known you off and on at a distance for years, and now I finally
Absolutely.
kind of get to meet you.
Absolutely. Well, thank you so much for agreeing to be on the podcast and tell me a little bit about yourself.
Okay, so right now I'm 62 years old. It's been 15 and a half years of a journey for me, and I grew up in St. Louis, Missouri. I moved up to Minnesota. Right now, I just try to take as good a care of myself as I can, enjoy my family as much as I can. I feel like I'm very lucky. I'm doing very well. I'm able to get out and exercise. I've been working up until August, and I'll start working again probably in the springtime.
Barry, what inspired you to attend nursing school? I know that you're a healthcare professional, and while you were in nursing school, did they teach you anything about MDS?
Well, so nursing school was almost a given for me after I got laid off. I had been a research chemist in drug discovery for years and years. And I don't know, I've always been interested in health. And kind of going to nursing school turned out to be a very natural thing. I guess finally doing clinicals with patients and seeing how patients had to deal with life as well as their illness really made a big impact on me. And it kind of changed my mind from being more of a scientist to being a partner with people, kind of coaching them, listening to them, doing all my nursing interventions, helping the doctors. I don't know, it's really been a great part of my life.
Did you study MDS or did you learn about it in nursing school?
Oh, not at all. Things were very general. We learned very basics because there's always things that are very basic regardless of what a person's diagnosis is. There's just always things we all have to do in our lives. And actually, the technical language for it is when I became a nursing assistant while I was going to nursing school. That actually taught me the most about people and just the activities of daily living, ADLs, feeding yourself, swallowing, being able to cook, being able to do hygiene. If you don't mind me getting into it, being able to go to the toilet on your own, being able to get yourself to a doctor's appointment, being able to communicate. I mean, regardless of your diagnosis, you want to be able to do all of these things.
How was your MDS discovered?
So I got laid off in 2010 and I decided, well, maybe I should get a physical. Hadn't had a physical in a while. Went and got a physical in my routine lab. Blood results showed my platelets were below 100K. So got retested. Everybody started getting anxious. I was like, what's the big deal? Didn't know that much about it. Got sent to a hematologist oncologist. Eventually, I let her do a bone marrow biopsy on me, and that was diagnostic for MDS The acronyms have changed. Anyway, all three of my blood lineages, red blood cells, white blood cells, and platelets were affected. I was still living a normal life.
And what were the treatment options that were offered to you, and what led to your decision for a transplant?
Okay, so this is in 2010. A lot of things have changed since then. So the way I would think people's hemoncs are talking to them now is going to be different from what it was like when I was first diagnosed, because I wasn't given a lot of information. I was mostly just given anxiety. And this is a pet peeve of mine with the healthcare industry. So I really wasn't given any options. It's like, well, we're just going to follow you. What is given the name wait and watch, or whatever it is, monitor and watch, which left me with a ton of anxiety. And of course, as a researcher, I started going to the medical literature and learning myself. I was in St. Louis at the time. This is the way my doctors treated me. I moved up to Minnesota in 2011, and right away I was happier with my hematologist oncologist as well as other medical people. And yeah, we were still doing the watching and waiting. And the hematologist oncologist here in Minnesota explained to me, I love the guy, we have to balance benefit with toxicity. And right now, I don't have anything that would make your life better. I want you to live the best life you can right now. I'll take care of all this other stuff. And I said to him, well, I'm not really going to let you just take care of it and ignore it, because I'm going to do my research. But I understand. And I would have lab blood draws every 3 months. And of course, the week or two before my 3-month blood draw, I would be flipped out. And then my results showed I was stable. I had some decreases in my blood counts, but I went for 8 years before I felt anything in my body that needed to be taken care of, that now there were options.
And how did you decide transplant was right for you? And how was the timing of your transplant?
Okay, so the short answer is, in October of 2018, my wonderful transplant doctor, who worked closely with my outpatient heme oncologist, but who I was now seeing the transplant doc. She said, well, it's time for a transplant. And I said, well, what if I don't have a transplant? I hear they're really nasty. And she said, well, I'll give you 6 months. And I
Oh,
liked
wow.
her. I liked her and I trusted her. She and our communication was great. I gave her
That's
a hard time. She gave me a hard time, and we both laughed. And at that appointment, I said to her, well, I don't know. I still don't know. Maybe I should just go on hospice, because I've done the research. This isn't an easy thing to go through. And even then, the outcomes. And she said, well, and we just kind of both sighed, and I said to her, what's going to happen? I'm going to get pushed out of the hospital in a wheelchair. I'm going to spend the rest of my life in a wheelchair. She goes, no, you're going to walk out of here. And I said, well, how can you be so sure? And she said, because I'm going to tell physical therapy to kick your ass. And I said, okay, I'll do it. It was that quick. Once she said I was going to have a life, I decided I would do it. I also trusted her.
It sounded like the two of you had a really good rapport and you were really good at communicating with each other. And she listened to you. It sounds like she really listened to your concerns.
Absolutely. Now, the prior 7 months before that, I was crawling up the steps in my apartment building while I was on Vidasa or azacitidine treatment to try to work with me rather than go directly to a transplant because it came down to the point where I was having a lot of shortness of breath. And eventually that did get better. And then when at the like 6 or 7 month mark, that's when the doctor said, "Well, we're ready for a transplant." And she said it with a smile.
Have you experienced any challenges since your transplant?
I have. I spent 7 weeks in the hospital. Normally, if everything goes right, you spend like 5. But I had severe acute GVHD while my blood counts were increasing after the radiation and chemotherapy prior to the actual stem cells. I also had a latent viral infection that was reactivated. Okay. Given all of that and given the treatment for those things, I now have chronic kidney disease. And I now go to Mayo in Rochester, which is very convenient for me, for my kidney work. I had a little bit of skin GVHD and the topical triamcinolone steroid cream cleared that up, and I have not had any problem with that. If I want to right now, I can go out and walk 4 or 5 miles. I exercise every day. I do a lot of internal Asian work, breathing exercises, stuff like that. And I worked. I was on disability for a few years. I went back to work as a triage nurse on the telephone, felt good enough to look for another job and luckily got hired in rehabilitation medicine, working with spines and brain injured people. And I've been doing that, but I have since had to cut it down because my energy has decreased.
And what have you learned about yourself since your MDS journey started?
Gosh. Honestly, this will sound weird, but I'd say these past 15 years, in spite of the anxiety and the challenges, have been the best of my life. I have made myself just go out and do things that I would hesitate to do previously. I enjoy life more. And I don't know, nursing school made a huge difference, and I kind of owe that to that outpatient hematologist oncologist who said, you need to just live your life. And I listened to him. You just never know what's going to be in the next moment or the next day or the next 3 month visit. I don't know what tomorrow's going to be like. I might be short of breath. So I want to work hard. I want to work hard the rest of my life to have a good life because I don't know what tomorrow's going to be like.
And Barry, do you have any advice for other MDS patients?
Yeah, keep yourself physically healthy and emotionally healthy as much as you can. Just do what you need to do. Don't worry about what other people are going to think of you. Try to surround yourself with good people. I mean, I was so lucky. I've had good people, and that's so important. And be thankful for what you have because you have an awful lot. And I know that kind of sounds trite. It's a good place to start from. Rather than starting from I'm ill, start from I can do all of these things and I want to do more. And we'll just see how it goes.
Thank you so much, Barry, for sharing your amazing 15-year journey with all of us. And if you like to learn more about MDS or transplant, please visit our website, which is aamds.org. If you'd like to speak with Barry or other patients through our peer support network, please shoot us an email at help@aamds.org or give us a call at 800-747-2820, and we can get you connected for support. And there's also our virtual support groups where you can get connected with others as well. So lots of supports happening for the MDS community. Thank you so much for joining us. And this is going to end our podcast.